Where you living? Who's taking? Who's giving? Let's talk about it. Real people, real voices.
Welcome to Real People, Real Voices. I'm your host, Reverend David W. Green Sr.
I'm your co-host, Pastor Wayne Moore.
Dr. Moore, good to see you.
Good to see you, my friend. Can I do our sponsors?
Please.
Yes. The Concerned Clergy of Indianapolis has been with us for some time in the city of Indianapolis, and also the Baptist Ministers Alliance. They are sponsors of this great show. Tomiko Associates Realty Group, His Place Eatery, Owl's Modern Clothing and Shoes, Marion County Public Health Department, Northside Windows and Gutter Cleaning, and Marion County Sheriff's Office, and Rodney Steps Music Productions, Lavinia Summers Home of Funerals. Those are our sponsors.
And we certainly thank God for all of our sponsors and thank God for all you viewing on tonight. We want to encourage all of our viewers to go to our YouTube channel, subscribe, so you can see the previous shows, access the great information that's going to be shared. You know, one of our passions that we need to see improvement in is in terms of health care.
Yes.
And so we've got a discussion tonight around a critical health care topic that continues despite years of work. We've got plenty of work, additional work that needs to be done. So we're going to take a quick break. Stay tuned. We're going to come back and hear from some young men who represent the Marion County Health Department,
Yes.
which is one of our sponsors.
Let's talk about it. Real people, real voices. Real people, real voices.
Welcome back to Real People, Real Voices. We're happy to have with us on today Mr. Coya Campbell and Aaron. They both work with the Marion County Health Department, and we're here to talk about HIV. Welcome to the program, gentlemen.
Thank you. Thank you both for having us.
Thank you. We appreciate it.
Well, we want to begin with, share with the listening audience where we are with this epidemic, HIV. What's the latest?
There's a lot going on, and there's a lot of misconceptions about HIV still to this day. I think the important thing is that there have been a lot of innovations, a lot of changes, and the community really needs to be aware of that.
Well, today is a great opportunity to share what those changes are. Can you begin to share with us, what are some of those critical changes that have taken place in recent?
I think one of the most passionate things or coolest things is about people living now. Before, HIV was a death sentence. And for years, AIDS-served organizations, ASOs we call them, they just helped individuals die with dignity. And now we have new technologies, new innovations in treatment and therapy that allow people to live normal, happy lives. And oftentimes when we encounter individuals living with HIV, we ask them, what's next? A lot of their dreams died years ago. They wanted to be a lot of different things, and it wasn't possible because they were pretty much just preparing to die with some dignity. And
Things have changed rapidly.
Absolutely.
They can look to longer and better lives now as functioning as HIV patients.
Right. And what we know about like viral suppression, that's where we measure how much blood is in an individual living with this disease. When it gets to a point where they're considered virally suppressed, where it's so low it's hard to measure it, we can even move them to a point of being what's called undetectable. And we even have a campaign called U equals U. And it means undetectable equals untransmittable. That through a person who reaches that plateau of undetectable, they can no longer transmit this virus via sex.
Oh, that's very, very progressive compared to where it first started with all of the misconceptions and how people were alienated with HIV. It seems like it has become part of the general population for people to be accepted now because of the advancements of HIV.
It's a game changer. I mean, it really is. And what it allows now individuals to live longer, live healthier. We have therapies now that can get them to a point of being undetectable or virally suppressed. And that's important because they can't transmit the disease, which means that the spread of infection is going down. And that's actually one of the new other innovative things that we wanted to share today is that we have, in 2019, we have a new program called Ending the HIV Epidemic, or EHE, a lot of us call it that, at vernacular. And in essence, by the year 2030, we hope to reduce any new infections nationally by 90%.
And are these treatments accessible to all parties, all people, or is it just insurance, people who have insurance?
Well, we encounter individuals like our Ryan White Services Program, named after Ryan White, who's from Indiana. It assists individuals who are underserved and uninsured population, those who have economic challenges.
Which is a large population.
Which is right, exactly. But the EHE, the Ending the HIV Epidemic platform, serves all persons living with HIV. So there's two distinct variations. We're trying to cover everyone living with HIV.
Tell us about, Aaron, tell us about December 1st, the Ryan White Day.
Right, so December 1st is World AIDS Day. It's a day to celebrate not only the fact that we've come so far as regards to the ways in which we can care for people living with HIV, but also to honor those that we've lost. Unfortunately, 700,000 people in the United States have died since the epidemic began, and we want to pay respect to those people, but also the Marion County Health Department at our 1650 North College address, we're going to be hosting essentially an open house. We want to make sure that folks feel welcome and feel like they can come and see what their health department is doing for them in their neighborhood. We're going to have a lot of services, so if people do want to receive testing, do want to talk to a medical provider about what they can do to either prevent any sort of HIV illnesses, or if they're living with HIV, learn what kind of services are out there to make sure that their lives are long and healthy and happy. So that's kind of what we're hoping to do, is get out in the community, make sure that people know that on that December 1st day, we can celebrate the fact that we've made so much progress and keep putting people in our community first and show that we're there for them. So
700,000 is the second largest pandemic in the history of the United States in the last 25 years.
That's right. I think there is...
The first one is
COVID-19, right? I think that's such an interesting parallel to draw, right? Because we here at Ryan White, when we talk about ending the epidemic, people will, it seems like COVID is gone, it's much better than it was in 2020. But here at Ryan White, we are facing a similar problem to people who are, trying to get vaccines out for the coronavirus, in that, we are still facing an epidemic that's ongoing. People are still living with HIV and still transmitting it. We want to make sure that, in both instances, we are reducing those infections and making sure that the people who are infected do live long and happy lives. That's a big part of why we're here.
With the increase of overdoses in our city, are there many people who are dying of HIV because of needle exchanges, not exchanging needles or using the same needles? Or syringes, let me use, that's the best.
Right, I mean, I think people who use injection drugs are a big population that we want to serve. And that is a huge reason that people do get HIV, unfortunately. But there's also ways to mitigate that. One of our biggest tools in the fight to end the epidemic is the use of pre-exposure prophylaxis. We call it PrEP. Basically, it's a medication you can either take a pill or get a shot. But basically, it prevents you from, I want to say, even in injection drug use cases, it's something like, 75 to 90% effective in preventing transmission of HIV. So we want to make sure that we're taking care of those people and making sure that we can reduce the harm that is done as much as possible.
Yeah, that's a game changer.
It definitely is a game changer, and I think just getting out the information that people know that this is available. I mean, I think that's part of the real challenge that people are, sometimes these labels and stigmas stick for so long. Trying to overcome that becomes a huge barrier, So any quick suggestions on, addressing those barriers and how the community, faith-based community, can assist with this, getting the message out?
I mean, I think one of the most important things that our faith-based communities can do is be vocal about the fact that, you know, HIV is a thing that people live with and a lot of people have. And, you know, stigma is such a sad thing because there is really no need to stigmatize an illness. It's no different than having, you know, diabetes or COPD. It is an illness that sometimes you get. It happens, and you can take steps to make sure that you are living a happy and healthy life in spite of it. And you know, that's such an important thing. You know, faith plays such an important role in our lives, and I would hope that our faith community helps spread that message.
Most definitely. Well, we need to take a quick break, and when we come back, we'll discuss more about this important topic of addressing HIV in our state. Stay tuned. We'll be right back.
Let's talk about it. Real people, real voices. Real people, real voices.
Welcome back to Real People, Real Voices. I'm your host, Reverend David W. Green Sr.
Co-host Pastor Wayne Moore.
And we have with us representative from the Marion County Health Department. We're talking about HIV, and we want to talk about testing and what does that look like in 2022. Are we seeing more people getting tested, a willingness to participate in testing? What does that look like now?
We are starting to see an increase in testing, especially around awareness. You know, and that's the key, is making sure people understand what really is current with HIV. There's still a lot of misconceptions, as you spoke earlier, about stigma, but getting people tested is critical. There are about 797 people that we believe who are living in Marion County who are infected with HIV, but not in care. And we need to find those individuals and get them into care and get them to understand that there's a care continuum where we can get them virally suppressed, undetectable, and they can go on living the normal, healthy lives that they were living, that they planned on living. It can be anything they want. I mean, maybe except for a professional athlete, but you know, that's just because of age.
Yeah, yeah. I think that's phenomenal, though, that the progress of maintaining HIV is there, but it's hard to find out those who need to participate in being medicated about it.
I think that's that stigma issue and fear. I think fear is a major reason in there. I mean, I know a lot of times in terms of health care, especially with people of color, there's a hesitancy to get the test to find out what the results are, so they rather operate in the unknown. But, you know, with HIV, because we've come so far from a medicine standpoint, what's available, people actually can live. They can live with
Productive lives
and do and pursue their dreams. It's not the, quote unquote, the death sentence it was originally. And so we can applaud the great scientists and others that God has used to create these drugs. But we've got a lot of work to do, Pastor, I think, just to alleviate the stigma. Be willing to talk about it, encourage people to get tested, encourage people to pursue the various options that are available, treatment options that may exist for them, because they can find something that works for them, correct?
Correct. And we address the social determinants of health as every public health and every entity that works in healthcare should. So 5 of the ones that we address are housing, economics or employment, transportation, nutrition, and social support. That's the big thing, especially with the faith-based community, you know, supporting individuals who are living with this disease. That's the one thing that we found that's consistent, that there's a sense of isolation. And so if you're living with anything and you have this isolation, it's a struggle. So it's very much a struggle for persons living with HIV because they've been in this silo for so long. You go out to dinner and you start talking about diabetes, nobody's head's turning around. But the moment you say HIV, everybody's going to look at you. They're going to look at the plate. They're going to make assumptions. They're going to develop these stigmas, or they're going to enforce some of the stigmas we've heard. And I've shared with people all the time that one thing I want to be a takeaway is that to understand that HIV is something that happened to a person. It's not who they are. And we should never address them as HIV. We don't go around saying, oh, this is diabetes man, or this is broken leg girl. So the same thing for HIV.
Task force, Aaron. Tell us about the mechanics that make up this task force.
Yeah, so the Ending the Epidemic Task Force is essentially a group of various organizations across the Indianapolis area. We have plenty of AIDS service organizations, but also some that do other things like help with housing or help get people fed. And essentially, we're all trying to work together and achieve specific outcomes and try to drive the winds of change here in Indianapolis to make sure that people are getting adequate care and treatment. A lot of that is towards prevention, making sure that people know about HIV and the risks involved with not receiving treatment. But also some of that is taking care of people who are living with HIV and making sure that they are, making sure that they're housed and clothed and fed and have a job. Those are, like Coya said, with all those determinants of health, we want to make sure that all of those are addressed, especially the ones related to community, right? To quote Genesis, right, it's not good for man to be alone. So we want to make sure that people living with HIV are not alone and that they have a community they can depend on. And the task force, I'm really, really trying to make sure that our work reinforces those ideas and makes sure that people living with HIV feel like they have a community that can back them up.
It's liberating. It's liberating. And we actually have a website, too, that we want, we love the community to know about and get on. It's called Side by Side, but the actual website is www.endinghivtogether.org. And I ask anyone, even if you're a person living with HIV, great, get on there. If you're a person who's not living with HIV, but you need some education, get on there. If you're a person who has no idea about HIV, don't know anything about it, get on there, because we have platforms that directly link you to whatever it is that you want to know or be a part of. We really love people to support whatever way they can this fight, because we know it's actual. We don't have a cure for HIV, but we can end this epidemic.
Yeah. And you have, Dr. Green, I think we've made successful inroads on this because when it first hit us in the 90s, I believe it was, or before, latter 80s, early 90s, people were frightened. Mm-hmm. And then we get this concept of monkeypox and how they tried to equate monkeypox to a certain community. Mm-hmm. Then people begin to raise their ears again. But the epidemic has been with us over 25 years. And we have made some great strides. And to have a person or individuals understand that I can have a productive life, no matter how I contracted the disease, I still have a right to live a productive life. Wraparound services, if I might say, President. Wraparound services. Say I don't have transportation, I don't have adequate food, I don't have ways to get medicine. What do you offer me, an individual with that?
Right. I mean, that's why it's so important that we have members of the community, our AIDS service organizations, working around, because while maybe one organization maybe doesn't have a specific provider, they can refer you to somebody else who does, and that is kind of the ways in which we lean on each other, and we are all kind of connected. We are trying to encourage collaboration among our various partners and volunteers to make sure that if somebody comes to us and says, "Hey, I need help," we can either say, "I can help you," or "I know somebody who can."
Yeah.
And it's important to once we diagnose our person has been identified that they know that they are living with HIV, is to link them into care. That's the critical piece, linkage to care. The national standards say 30 days. Well, that's too long. Really 72 hours is really kind of our standard. We call it rapid engagement, but we're looking to get individuals into a care home within 72 hours, which will address some of those needs of transportation or medication or even awareness and education, how to have them talk to relatives or friends or, share their diagnosis with people they trust that will help them in the fight. It goes back to that social support.
Yeah.
Because that's critical. I mean, it's like anything else. We've got to do this together. Mm-hmm. And that togetherness, that collaboration is what makes a difference and helps people survive and make it. And we should want that. We got to see, these are all our brothers and sisters. And that's how we got to see them. That's how God would see them. And we got to focus on doing it together. Well, thank you for coming. Thank you for informing our audience in terms of what's going on with HIV. We need to take a break, and when we come back, we'll have our rundown.
Let's talk about it. Real people. Voices.
Welcome back to Real People, Real Voices. I'm your host, Reverend David W. Green Sr.
And I'm your co-host, Wayne L. Moore.
And I'm your producer, Curtis M. Baker. And before I even start, I've been doing this and kind of leaving my Aunt Jeanette off at the end.
Mm-hmm.
And Aunt Jeanette, I know I've said goodbye to you, but you probably don't really hear, but I want people in Kokomo to know that you're not forgotten. So, Aunt Jeanette, our faithful Real People, Real Voices viewer, I want you to know that. So, but before we do that, I want to also talk about the sponsors. Is that okay?
Yes, sir.
Okay. Concerned Clergy of Indianapolis, the Baptist Minister Alliance, Tamiko Associates Realty Group, His Place Eatery, Yum Yum, Al's Modern Clothing and Shoes, the Marion County Public Health Department is one of our great sponsors. We love them. Northside Window and Gutter Cleaning, Marion County Sheriff's Office, Rodney Stepp Music Productions, and Lavinia and Summers Home for Funerals are great sponsors.
Great segment, man.
It was a great segment to hear about the innovation that is taking place in terms of HIV treatments.
Because, I was one of those when it first came out because of a lack of education. Remained very, very frightened about it.
Right.
But today, it's nothing to be frightened about. It's everything about taking care of yourself after diagnosis. Want to link people to care.
Lack of information can be very dangerous.
Yes.
Without a doubt. And these stigmas get in the way of us pursuing these things that are available to us. I mean, the fact that these treatments, this innovation is available, we've got to make sure we encourage people to take advantage of it, that people can live. One of the benefits of living in the USA is it is a country with means to create solutions to difficult problems so that people can live.
Right, and that's what I like about Real People, Real Voices. So much great information is always disseminated from this program, and I applaud you too for bringing that to the forefront.
Thank you so much.
Thank you, producer. Well, our time is up for this evening. Real People, Real Voices. Our team says to you, have a great evening, and remember, let's talk about it.